New at 5 these days, we have an app for everything. What if there was an app to help ease the overcrowding in emergency rooms and in turn give EMTs a chance to help more patients across Fresno County? Well, now there is one. Our Dennis Valera joins us in studio to show us how it works. Dennis.
Alex, right now is especially a tough time in hospitals with the flu sending so many to the ER. Over the years, the county's public health department has rolled out several new procedures, even getting their crews a new app.
Like RMC currently has 4 ambulances at the hospital.
We're looking at the LinkStat app. To the left, the hospitals. The right, how many ambulances are already there and how many are on the way. Also, how long the first one has been waiting. It's been informing crews which hospital is the best one to bring their patients to because too many are sitting at ERs waiting. According to the latest state data, in June 2017, 90% of ambulances sent to CRMC stayed there more than an hour. St. Agnes, more than 40 minutes, both higher than the state standard of 30 minutes.
We've had an incident recently that's been up to 6 to 7 hours. And that's a long time. That's too long because those ambulances need to be out in the community.
Dan Lynch is Fresno County's EMS director. He says aside from the app, crews now also drop off patients into ER waiting rooms if they don't need immediate care.
That day of people thinking that they can call the ambulance because it'll be quicker to get seen, those days are gone because the ambulance will actually take them to the waiting room and leave them in the waiting room.
Lynch says the biggest thing is identifying frequent flyers, people who are using ambulances too much, but it's getting easier to deal with thanks to things like the LinkStat app.
We're looking for any way to keep ambulances from getting stuck in those emergency departments and not serving their communities.
Now, as we've reported, another way Fresno County has helped with the ambulance issue is sending qualified mental health patients directly to crisis centers, not the ER. Live in studio, Dennis Valera, KC24, local news that matters.